So revision rhinoplasty is a operation or rhinoplasty operation on a patient who's had a rhinoplasty previously, or actually other types of nasal surgery previously as well, such as septoplasty. The aspects to consider here are that if the patient had surgery to the nose before, there will be scar tissue formation, and also the previous operation may have resulted in a change in the anatomy of the nose, therefore making the revision operation slightly more difficult, or sometimes much more difficult, and also other techniques need to be included in those operations. Now, the first general thing to be aware of is that in your first rhinoplasty, cartilage and bone may have been removed from the nose in order to achieve a desired effect. Now, this directly impacts the revision operation because there may not be enough cartilage inside the nose to reconstruct the nose in order to gain the desired outcome. And therefore, cartilage or donor cartilage from elsewhere may need to be required. Now, this can sometimes be from the patient's own body. So taking ear cartilage or rib cartilage is often used to help reconstruct the nose. Or there is the option of cartilage that's been donated by somebody else and irradiated so it does not get rejected from the body and used, or sometimes certain implants can be used, and this depends on what needs to be done. Additionally, as mentioned, there will be scar tissue formation from the previous operation, so therefore in a revision rhinoplasty there may be more bleeding, there may be more swelling after surgery as well, and additionally that means there could be more swelling for a long period of time after surgery, and that swelling may change from a day-to-day basis in compared to a primary operation. Additionally, there are limitations to what can be done certainly in revision operations because of the way that the tissue heals and the nature of the tissue healing in revision operations. So it's important to have an idea of what your aim of the surgery is and understand what may and may not be possible in these revision operations. So it's important, if you're thinking about undertaking revision rhinoplasty surgery, to have a clear aim and then an understanding of all these other aspects that may be required in the surgery.